Good morning. My name is Deirdre. I am one of the trainers here today at Exxon. Today we're going to be talking about surgery insights. Before we start, just a little bit of housekeeping. My colleague James is on the call as well in the background. He is facilitating for me today. So if there are any questions, please do feel free to ask in the Q&A box or the chat box, whichever you feel more comfortable with. And also, as we go through, James will be adding links in for you. Okay, so anything I'm talking about, there will be links put into the chat. So keep an eye open for those. Little bit of housekeeping. We are recording this really so that we can share it with you afterwards, and you can share with your colleagues if needed. Okay, should take about 30 minutes to 45 minutes. So let's get started. So today we're going to have a whistle-stop tour of Surgery Insights. It's a collection of dashboards for the GP practices and PCNs designed to optimise patient access and streamline operations all in one place. It provides integrated data streams combining publicly available NHS data with live telephony and digital assistance metrics from Exxon Health and third-party suppliers. We have operational intelligence, a month-by-month view to explore relationships between data sets, such as comparing inbound calls against online consultations, and performance tracking, delivering regular updates on workforce and appointments and NHS app usage, typically reflecting the month end within 1 week of data being available. Okay, the primary value of Surgery Insights is to help you basically move forward from reactive management to data-driven decision making. Firstly, it allows you to optimise workforce capacity by matching staffing levels directly to patient demand. This really helps reduce missed calls and identifies where admin tasks can be shifted to digital channels. Secondly, it can provide benchmarking against national standards. So you're able to compare your appointment volumes, DNA rates, and consultation trends against national averages to clearly identify performance gaps. Finally, it helps you measure digital product adoption. So you can quantify the tangible staff time gained and the number of calls deflected by using tools like our Surgery Assist, Omni Consultation, Surgery Intellect, and the NHS app. We will be going into what they actually mean later. Okay. Ultimately, these reports give you the insight needed to bridge performance gaps and maximise your team's efficiency. Okay, as we've said, Surgery Insights acts as a central hub, consolidating your practice data into one unified dashboard, really saving you having to jump between different views to grab data. It allows you to monitor critical performance areas, including operational demand, workforce capacity, and digital adoption. It also helps you assess patient satisfaction and experience, while this provides you also with clear benchmarks against national standards, which is really good. By bringing the demand, capacity and efficiency metrics into one single view, the dashboard enables you to quickly identify areas for improvement, and then you can make data-driven decisions for your practice. After any changes have been made, you will then also be able to see how it's clearly working for you, making a difference. Beyond being a central hub, Surgery Insights is an integrated system designed to grow alongside your practice. Whether you're using existing Exxon Health tools like the Omni, Surgery Intellect, etc., or you're adding new features in the future, all your data will flow automatically into one single holistic view, including third-party data if access has been allowed. How do we access this? So if you're already a Surgery Connect customer and have procured Surgery Insights, you can access the dashboard directly from the reports console, which, as you probably know, you can get that from the phone bar or the single sign-on webpage. If you're not a Surgery Connect customer, it can be accessed via a direct link. But I'm guessing today that you guys all are Surgery Connect customers because you're on this. Okay, let me just go straight to the reports for you for now. We'll just have a look at some of the tabs. Firstly, the welcome page. Now, the welcome page, just to let you know, to point out that I am going to be working down the left-hand side here to the tabs. We're going to go into all the relevant ones for you, but you can also navigate across the bottom if you wanted to. Okay, so you can do it either way, and it will just automatically jump to that when I go down here. It will jump across the bottom. So all of the reports that I'm going to show you, you'll see that there are different ways that you can, adopt, and data can be exported from here. Here on the welcome page, this welcome page really is based on a lot of feedback that we received from the initial rollout of Insights over the past couple of years, and what practices wanted to see at this top level. So as you can see across the top here, we've got benchmarks against the national average statistics for things like DNAs, missed calls, etc. Now, when they're green, it means it's matched or exceeded those averages. When it's red, it's fallen slightly below. Okay. On here, you can see that this measures the monthly balance between phone calls, digital consultations, physical appointments. So you've got a really good view of that, and you can just scroll across and it will go across here on a time frame. Okay. It measures monthly balances between phone calls, digital consultations and physical appointments. And also you've got down here at the bottom, you've got the percentage of patients registered to the practice. You can see there's a fall in this one. And then you've got the breakdown of the GP patient survey, which we all love. And over here, this will track here the admin staffing levels, and also on here clinic, it breaks it into clinical and admin. It says FTE there, that just means full-time equivalent, just to let you know. Okay, so just going to move down to the next one. This is a really nice tab. It's called the activity summary. It's a really good visual. It shows your practice's digital transformation. It maps exactly how patients are accessing your service by combining data from all inbound channels. Now, across the top, just to let you know, on every one of these slides, there are different views that you can click in to see these. At the moment, we're on the visual view, so it's a nicer one for me to kind of show you, but you can click into the others if you wish. And across the top, as I showed you before, you've always got these national averages. Okay, so it just gives you those on here. So as an example, when you start introducing new technology such as Surgery Assist, again, I will tell you what all of these things are. Surgery Assist, the dashboard indicates it will indicate the go live date of when you've taken that on, and it will show a dotted marker. We don't have it on here, but it will show a dotted line, and you'll then be able to see the difference. Now, what you'd expect to see if you do take on any of these different things, here on this orange bar, these are the inbound calls. Okay, the inbound call traffic. Now, once we start introducing different tools, we should see this go down. So the calls will go down, and then when we look up here, this one is for online consultations. They'll go up. Okay, the blue, the grey, NHS app, prescription activity. So it will show you all of those. And if you did go for the Surgery Assist, which is a chatbot, you can see here how many of those are being used as well. So you can see the trend should go down for your calls, which is obviously amazing. Now, let's just jump down to the all-important telephony reports, okay, because we all know you've all got telephony. So on the telephony reports, this over here, the tab provides a detailed breakdown of how your practice handles phone traffic, really. It's essential for identifying pain points and understanding how patients navigate the automated menus. And it's also available in your standard telephony reports, but it's you get a better visual on it on here. It's designed to give you total visibility over your inbound call traffic. So whether you're using automated tools or just standard telephony, you'll be able to see everything. So here we can see the inbound calls. So you can see the calls that have queued. So you can see here how many have queued on a monthly basis. Okay, so you can see the trends. So you can see how many calls have queued. You can see how many calls have been abandoned, and at the top, how many calls that have been missed from that queue. So don't forget, I'm sure you're all aware, the difference between missed and abandoned calls. Missed calls are the ones that are to be more concerned about. They're the ones that have actually queued and they've given up. Abandoned calls are the calls that haven't even reached the queue. So we always think that is actually a positive thing because you may have signposted them elsewhere. Did you know you could use the NHS app? Yep, so they're using things like that. So don't forget, abandoned sounds worse than it is. That is an actual positive trend. Patient callback area. So it gives you a good view here of the people using the patient callback feature, where they're allowed to, I'm sure you were aware, but where they can choose to be automatically called back from the system, saving them waiting. And it also here shows the success rate, okay, of that patient callback. Now down here, we've got the wait time. So you can see as it goes along your peaks and troughs of how long people are waiting for, and also the average talk time. So it gives you both of those in one metric. And the final one, menu choices. So what are people choosing from your menus? As expected, this navy blue one here is appointments, and these ones are the most popular, which is most surgeries. Then we've got general inquiries, prescriptions, and test results. Okay, next one I'm going to take you to is appointments. Okay, so these are your appointments. So the dashboard offers a detailed analysis of clinical workload by benchmarking your surgery's performance against national NHS standards. It tracks key metrics such as appointments, attendance, trends, DNA, appointment lead times, and the balance of care between GPs and the wider clinical team. The goal is really just to move from simply tracking volumes to gaining a deep understanding of what your appointment slots represent and enable better management of that time. Again, as we say, it compares to the DNA rates up here as well in the appointments. It compares with the NHS averages. This visualises exactly where the clinical time is spent, from triage and routine care to acute consultations. So you'll be able to see on here that. And down here, you've got this illustrates the balance between the doctors and the wider teams for the appointments. So GP, other practice staff like pharmacists, nurses, etc. And this tracks the missed appointments on a monthly basis. So that gives you a really good sort of understanding of that. Okay, now NHS app. Everyone's using that now. Well, most people. When we go to the NHS app report, it shows you an overview of how your patients are interacting with it, really. The report is split into 5 key areas. So you can see here, it shows the uptake, the usage, how they're actually using it, messaging, if they're using it for messaging, jump offs, and also data table. Any of our reports, as I said, you can see different views and you can export these reports at any time as well if you needed to. This shows how many people have registered for the NHS app. Okay, so that will be obviously with the time frame that we've got, you know, here. So you can see how many. We've kind of put it over a couple of years just so that you can see trends and everything going forward. But you can change that at any time by just clicking into this icon on here, and it will come up with the date range, and you can change the date range at any time. Okay, so it shows how many people have the uptake really of the NHS app. Here it shows the national average. So it compares the national average. So this surgery, which is obviously anonymous, this surgery here has exceeded that. Okay, it's 75%. We're hoping for people to take up, at least 75% of your patients to take up the NHS app. So this is kind of like registrations per 1,000 patients in the month. What percentage of patients are registered? Also, this bottom graph is quite a good one. It's quite interesting. It shows how many people engage in the organ donor register. Basically, lookups and uptakes. So this actually, since I've been looking at these reports when it was new to me, I didn't realise that this could be done on the NHS app. So I've actually registered myself. So you'll be able to see on here what people are doing. So the lookups, the updates, and also withdrawals, if anyone's withdrawn from it. Okay, so it will actually give you a really good understanding of that. Right, so I'm going to go to Surgery Assist. Okay, now I know that I've mentioned it a couple of times before, but just to give you a bit of an idea what Surgery Assist is. It's our new NHS, well, not new, it's our NHS approved digital assistant. It's not new anymore. It's really designed to signpost and educate patients towards appropriate healthcare and community services. Hopefully will reduce the demand on surgeries and make the increasing use of the NHS app healthier, and also online consultation tools. So with the it's a chatbot basically. So with the timings option on here, it provides a closer look at the volumes of chats by day and hour. We notice that this is available 24 hours. We do notice, like, late on Saturday nights, there could be mental health questions coming up, and it's there for people all the time. Signpost them to different things, gives them telephone numbers, anything like that. So it's basically an AI chat. Now, the AI questions, that's really interesting. It will actually show what people are actually, every single question that somebody's asked. And you can see on here, the most important one here, or the most used one, is I want to book an appointment, like everything else really. Can I have a blood test? Order a prescription? There are some quite interesting ones that do come up on here, but these are the top AI ones. They put them on here. You can dig in and you can delve deeper into it, and you can see all of the ones that are actually being asked. So we've got like the heat map over here that will show us basically on here, it measures the total volumes of conversations. On here, saved calls, basically how many calls that have been saved after the SMS has gone through. That these are basically calls that haven't had to be asked, and the top questions asked on there as well. Okay, right, so let's go to the next one. So on here, we've got our good old Surgery Intellect. So you may or may not be using Surgery Intellect at the moment. Surgery Intellect is our voice-enabled AI assistant. It uses ambient voice technology to listen, transcribe, and code consultations, and it's accessed via the phone bar. So you would need to be using the phone bar to have it. If you are interested in any of these products, including a Surgery Intellect, if you're interested in that, my colleague James is putting, just to remind you, he is putting links into the chat boxes for you. And we are running a 3-month trial on Surgery Intellect. So if you haven't got it already, it might be a nice time to apply to have it to try. It's free. It's always good to have something free to try. And the good thing about our Surgery Intellect is that you can use it via, it transcribes consultations via both the phone bar. So if you're making a telephone consultation, it transcribes that, or face-to-face. Okay. Now here, what it does here is it shows you on here how many how many basically intellects that have been used in that said period, how many times it's been used by your staff. It shows you the audio length, so how many days of audio that have been, or hours or days of audio that's been recorded, and the word count. Okay, so how many words have been transcribed, which is really good. And really on here, this shows you the estimated hours of times, the clinician's time that's been saved over a said period. Okay, so it will just tell you how many hours that have been saved. That's time saved is basically based on 15% of the audio duration. It displays the staff usage, so you can see here on here how many intellects on a monthly basis that's been done, and also the outcomes on here. So it tracks the generation of the specific clinical outputs, so the coding, the letters, etc. So you'll be able to see all of that on here. So it's a really good metric for you to see on here. So that is our surgery intellect. Now, the next one is going to be our Omni consultation. So I will explain to you what that is. So the Omni consultation forms on our system allows the patients to submit medical requests directly to your practice. The whole point really is to make it easier for them to access rather than having to wait in queues and answer calls to be answered. The information is basically compiled into responses, allowing your staff to easily manage the triage workflow. So there's 3 ways for the consultation forms to be to gather information. One is by voice agent, so they can call in and the AI voice will ask them questions and they answer the questions, and that then comes into your surgery once they've completed it. The other way is by web form. So there'll be a form on the website they can fill in and that will go straight to your surgery as well. And then the final way will be manual entry by staff. So they call in, on the phone bar there's the forms and the staff can then take the information from the patient, fill it in automatically. Okay, so again, this report is only visible if you are using the feature. It provides a high-level breakdown of how patients are reaching the surgery. It also displays the raw numerical count, for each consultation channel. So on here, again, time saving with Omni. So it shows you the estimated time that is saved. It shows on here again the raw numerical count estimated of clinical staff time saved, and shows volumes of consultation, so you can track seasonal trends and growth by month. And it does categorize the clinical urgency and patients that when they've reported the consultations. So there's quite a lot of information here so that you can see. Okay, we're going to go to the online consultations as opposed to the Omni. So this tracks the total numbers of online requests. The bar chart here will show the total volume of digital requests each month to track the growth over time. This chart here, this shows the percentage split of requests between admin, clinical, and other categories. And the line graph, what this one here does is it will actually compare your surgery's monthly digital usage rate against the national average trend. That's based on 1,000 patients. Okay, so you can see the trends on here. Okay, so the next one we're going to look at is really interesting. It's the operational efficiency. Now, what the operational efficiency tab is for, it provides you with a data-driven look at how digital tools are reducing the admin burden on your team. So if you think about it, all the other metrics that we've looked at, all the other tabs, they're like a magnifying glass. So it kind of looks at things, specific tools. The operational efficiency tab is like your wide angled lens. So it's basically where it brings everything together for you. And whether you're using Surgery Assist, Surgery Intellect, or Omni Consultation, this one calculates the cumulative impact across your entire product suite. So it shows hours saved by Assist, hours saved by Intellect, hours saved by Omni Consultations, and then it summarises the overall impact, showing the total minutes and days of staff time saved. And it also then shows the growth as well. So it will go across and show the total minutes and days of staff's time saved, really, and shows the growth of impact over time on patients using the digital tools. Okay, so the GP patient survey, everyone's favourite. Let's go and take a look at that one. So what this does, it makes yearly comparisons and view in a data table. There's a snapshot of the overall GP experience and ease of contact. Okay, it visualizes the quality of the patient experiences across different channels like websites, NHS app. It pinpoints which services that need operational improvement, so you can see, where you need to improve. And it tracks exactly how patients attempted to contact the surgery and what the outcome of those attempts were. It will monitor, the adoption of digital services like the test results, viewing and repeat prescriptions, as well as pharmacy utilisation. So this slide really speaks for itself. It's a really, really insightful slide, I believe. Okay, now the final tab that I'm going to show you is the resources. Now with the resources tab, it shows you where all the data comes from. Okay, so it will allow you then basically to see where the data comes from. If you're interested, you can contact Exxon Health, quick access to our tech support, shows transparency of the freshness of the data that's being viewed and the audit trail mapping every metric. So it's a very, very useful slide tab. Now, we have actually been hearing some really good feedback from our customers with this insights, bringing everything together. It's really saved people a lot of time and been really, really insightful. So this is just one of them that we've got. Okay, so it's just a feedback that we've got from Sarah, who's the Operations Development Manager at Western Grove Partnership. She was very interested in this. So I just wanted to let you know about one other thing. If you haven't already been on our academy has been totally revamped and refreshed. It's a really, really good thing to go on to. Have a look at it. Okay, it allows you to go on and you can access relevant CPD accredited learning, get certificates for your staff, and it's relative. So they have the relative lessons for clinicians, for reception and admin, practice managers. So have a take a look at that. The link will be put in by James, just to let you know, in the chat box along with the others. Okay, so that's our academy. So you will be glad to know that we have finished. I'd just like to thank you so much for joining. And if you, again, as I say, if you are interested in anything that I've been talking about today, please reach out to your dedicated customer success advisor. All the links and email addresses are put into the chat, as I said, but do feel free if you wanted to talk to anybody. If you wanted any training on anything, contact us at training@x-on.co.uk. James will also put that into the chat as well. But for now, that's thank you so much and for joining. Do appreciate you joining and spending your time here, and I hope it was of some use to you. Thank you very much and goodbye.